I can remember Keith Hyland talking about this at a neurotransmitter disease symposium. I was involved with organizing at the NIH when I was in Bethesda in Washington. But it turns out Keith, who's at Medical Neurogenetics in Atlanta, described this condition back in 1990 with Peter Clayton, in whose lab he was working. And of course, Peter Clayton, very famous neurometabolic pediatrician at the Great Ormond Street Hospital in London, where the statue of Peter Pan is in front. If you ever get to go there, I had a visit there before the pandemic, so I was able to go and give lectures, and it's a really cool place. So they described the disorder in two twins, two identical twins actually, and they were doing CSF neurotransmitters. And at the time, their focus was on disorders of tetrahydrobiopterin synthesis and recycling, which are also very rare. But they figured out that these twins had very low CSF HVA and 5-HIAA, and did enzymatic analysis as well, including from liver, and documented the first cases identified of AADC deficiency. I remember in medical school learning about decarboxylase with Parkinson's disease, and now it turns out really the enzyme is aromatic amino acid decarboxylase, AADC. So we're talking about the same enzyme, but of course it involves not just the dopaminergic line, but the serotoninergic line. So to me, that's when it was first identified, and it's still ultra rare. And I still rely on Keith's lab to send neurotransmitters. It's not done that many places in the United States. We can send neurotransmitters to that lab. We can send them to the Baylor lab in Dallas. And I'm not really sure where else does them in the United States. To ask Irina, because I know Dr. Anselm has some long experience with this disorder. I'm not really sure how, much Dr. Marks and Dr. O'Malley have been able to see this disorder, but we're going to ask you about treatment of movement disorders. But Irina, why don't you go ahead and just tell us about your experience with AADC deficiency and managing it, any insights you have.
Yeah, so my first case was actually is 1998, and I remember I received a phone call from Keith Hyland. He was so excited that there is yet another case that is uncovered, and that was actually in a 17-year-old young man who was not diagnosed appropriately for his entire life and suffered from all complications of AADC deficiency with ocular gyrate crisis, dystonia, and so on. So, and then I had two more cases that I inherited from other neurologists, and I still follow this already adults. They're both 25. And then I think there is another case, Phil, that we share, a child from Saudi Arabia, right? So yes, condition is rare, but of course it's very frequently is undiagnosed or misdiagnosed, and we can talk about that. We don't know the incidence or prevalence of this condition, but there are studies that estimated that the predicted birth rate is from about 1 per 32,000 to 1 per 182,000 births, depending on the country. So which gives the prevalence of this condition in the world to be around 1,800. And so, but there are only about 130 cases reported in the literature. So we can conclude that many cases are undiagnosed, and maybe some are not reported, but yes, condition is definitely rare, but there are definitely more cases that we know about.